What is rubella virus and how is it transmitted from one person to another? Could you please provide me a comprehensive explanation of its transmission?
Rubella, also known as German measles, is a contagious viral infection caused by the rubella virus. It's generally mild in children and adults, but it can cause serious complications if a pregnant woman contracts it, as it can lead to congenital rubella syndrome in the unborn child. Transmission of rubella occurs mainly through airborne droplets. If another person inhales these droplets, or touches surfaces where the droplets have settled, and then touches their face, they can become infected. A person infected with rubella can transmit the virus from a week before the rash appears until about a week after. Pregnant women with rubella can also pass the virus to their developing baby through the bloodstream, which is particularly dangerous during the first trimester.
Can you delve into the details of the symptoms and potential complications of rubella?
Rubella symptoms are usually mild, especially in children, and can sometimes go unnoticed. When symptoms do appear, they typically show up 2 to 3 weeks after exposure. The most common symptoms include mild fever, often one of the first signs, with temperatures around 38 degrees Celsius, 100.4 degrees Fahrenheit. Rash, a pink or light red rash usually starts on the face and spreads to the rest of the body, lasting about 3 days. Joint pain, more common in adults, especially women. Mild cold-like symptoms, such as a sore throat, runny nose, and cough. While rubella is usually mild, it can cause serious complications in some cases. 1. Congenital rubella syndrome, CRS. If a pregnant woman contracts rubella, especially during the first trimester, the virus can cause severe birth defects in the baby. These can include heart problems, vision and hearing impairments, developmental delays, and other serious conditions. 2. Arthritis. Temporary joint pain and swelling can occur in adults, especially women. 3. Encephalitis. In rare cases, rubella can lead to brain inflammation, which can be life-threatening. 4. Thrombocytopenia. A condition where blood platelets drop, leading to bleeding problems, is another rare complication. Rubella is particularly concerning for pregnant women because of the risks to the unborn baby. However, vaccination has made rubella much less common in many parts of the world.
Once a person is diagnosed, what are the necessary steps for managing the disease? Meaning, what actions should be taken when someone is diagnosed with rubella?
When someone is diagnosed with rubella, the primary goal is to manage symptoms and prevent the spread of the virus. Here are the key steps. 1. Isolation. To avoid spreading the infection, the person with rubella should be isolated, particularly from pregnant women, for at least 7 days after the rash appears. Isolation is important because rubella is highly contagious before symptoms show up and continues to be for a few days afterward. 2. Rest and hydration. Since rubella is usually mild, management involves plenty of rest and drinking fluids to stay hydrated. They fight off the virus more effectively. 3. Symptom relief. Over-the-counter medications such as acetaminophen or ibuprofen can be taken to relieve fever, joint pain, and headaches. However, aspirin should be avoided in children due to the risk of Ray's syndrome. 4. Monitoring pregnancy risks. If the infected person is pregnant or has been in contact with a pregnant woman, immediate medical advice is essential. Rubella can cause serious harm to unborn babies, and doctors may recommend testing or additional precautions to minimize the risk. 5. Notify close contacts. It's exposed, especially those who are not vaccinated or are at higher risk, such as pregnant women. Public health authorities may also need to be informed to help contain the spread. There is no specific antiviral treatment for rubella. The infection usually clears up on its own. However, prevention through vaccination is the best way to avoid rubella and its complications.
Are there traditional treatments or alternative medicine approaches that some people use for treating these viruses? From a medical perspective, why should these treatments be avoided or considered unreliable?
Yes, in some cultures, people may turn to traditional or alternative medicine treatments for rubella, such as herbal remedies, homeopathy, or acupuncture, hoping to alleviate symptoms. Some common approaches might include using herbal teas to reduce fever, applying compresses to the rash, or turning to dietary supplements believed to boost the immune system. However, from a medical perspective, these treatments should be approached with caution for several reasons. 1. Lack of scientific evidence. Most alternative treatments for viral infections like rubella are not backed by scientific studies. They may be based on anecdotal evidence or traditional practices, but they haven't undergone rigorous testing to prove their effectiveness in managing the virus. 2. Risk of delayed treatment. Relying on unproven remedies can delay seeking proper medical care, leading to a greater risk of complications, especially in high-risk groups like pregnant women. Medical care primarily focuses on symptom management, isolation, and prevention of complications through vaccination. 3. Potential harm. Some traditional remedies could interact with other medications or have unintended side effects. For example, herbal treatments might affect liver or kidney function or cause allergic reactions. 4. False security. Believing that alternative treatments can cure rubella might give a false sense of security, especially in preventing its transmission. For these reasons, it's recommended to follow medical advice and rely on proven methods to manage rubella, such as rest, hydration, and symptom relief, while prioritizing prevention through vaccination. Alternative remedies might offer comfort, but they should not replace evidence-based medical care.
When someone with the virus seeks medical attention at a health center, what is the purpose of healthcare protocols taken? Is medical care aimed at directly treating the virus, or is it more about boosting the immune system to fight the virus? This is already mentioned by you previously, but I want you to give another approach so every categories of humans will understand this.
When someone with rubella seeks medical attention, the main goal of healthcare protocols is to manage the symptoms and prevent the virus from spreading to others, especially those who are vulnerable, like pregnant women. Medical care for rubella is not focused on directly killing the virus, because there isn't a specific antiviral medication for rubella itself. Instead, it's about helping the body deal with the infection and minimizing complications. To explain it simply, for the average person, the body's immune system is responsible for fighting off the rubella virus. Doctors can't give you medicine that will directly kill the virus, but they can help make you more comfortable. You might get advice to rest, drink fluids, and take medicine to reduce fever or pain. The goal is to make sure your body is in the best shape to recover while also preventing you from passing the virus to others. For high-risk individuals like pregnant women, the concern is much bigger because rubella can cause serious birth defects if a pregnant woman catches the virus. Healthcare protocols are strict to protect these individuals. This is why people with rubella are isolated and why doctors may carefully monitor pregnant women if they've been exposed to the virus. For the public, the main priority is to stop the virus from spreading. That's why isolation is important, and it's also why vaccination is such a big deal. The MMR vaccine, which covers measles, mumps, and rubella, is key to preventing outbreaks. So while doctors can't directly treat the rubella virus, medical care focuses on giving your body the support it needs to fight the infection and stopping the virus from spreading to others who might be at risk.
Speaking of pregnant women, can you provide an in-depth explanation of how the virus affects a fetus?
Rubella is particularly dangerous for pregnant women because it can cause congenital rubella syndrome, CRS, which severely affects a developing fetus. The greatest risk occurs when a woman contracts rubella during the first trimester of pregnancy, especially in the first 12 weeks, when the baby's organs are forming. This exposure can cause a range of developmental problems, as the virus interferes with the normal growth of organs and tissues. 2. Impact on the fetus. The extent of harm depends on when during the pregnancy the mother becomes infected. First trimester, especially before week 12, this is the most dangerous period. The virus can cause severe birth defects or miscarriage. The earlier the infection, the higher the risk. Second trimester, there is still a risk of congenital defects, but it's generally lower than in the first trimester. Third trimester, the risks are lower, but if the baby is infected late in pregnancy, they might be born with rubella and could still suffer complications. 3. Congenital rubella syndrome, CRS. Babies born with CRS can have a wide range of serious health problems. The classic signs of CRS include heart defects. Conditions like patent ductus arteriosus, PDA, or other heart malformations can affect blood circulation and require surgery or medical management. Hearing loss. This is one of the most common issues, and it may be profound, causing permanent deafness. Eye defects, cataracts, cloudy lenses, glaucoma, eye pressure issues, or retinopathy, damage to the retina, can impair vision or lead to blindness. Developmental delays, cognitive disabilities, learning difficulties, and motor delays can occur as the brain is affected. Growth retardation. Babies with CRS may be born smaller than normal and may have trouble growing normally after birth. For other complications, these may include liver and spleen damage. Enlargement of these organs, along with low blood platelets, can cause bleeding issues. Bone problems. Bone abnormalities might lead to physical deformities. Endocrine disorders. The child could later develop conditions like diabetes or thyroid problems. 5. Long-term effects. Some of the complications may not appear immediately but might develop over time as the child grows. For example, hearing or vision problems might not be obvious at birth, but could show up in early childhood. 6. Prevention. The most effective way to prevent CRS is vaccination. The rubella vaccine, part of the MMR vaccine, is highly effective, and vaccination programs have dramatically reduced the incidence of rubella and CRS in many countries. Pregnant women who are not immune to rubella, usually determined through a blood test, should avoid exposure to the virus and may receive the vaccine after delivery to protect future pregnancies. It can lead to lifelong disabilities, severe birth defects, and even death. This is why it's critical to prevent rubella infections in pregnant women, primarily through vaccination.
Are there vaccines approved worldwide for the prevention of the virus? And how are these vaccinations administered? And are they only given during childhood, or are there boosters or booster shots available for adults as well?
Yes, the most widely approved vaccine for preventing rubella is the MMR vaccine, which protects against measles, mumps, and rubella. This vaccine is approved and used globally and is highly effective in preventing rubella infection. There's also an MMRV vaccine that includes protection against varicella chickenpox, but the MMR is the more common form. Administration of the MMR vaccine. For children, the MMR vaccine is typically given in 2 doses during childhood. The first dose is usually administered around 12 to 15 months of age. The second dose is given between 4 to 6 years old, though it can be administered earlier, as long as it's at least 28 days after the first dose. For adults, in some cases, adults may need the vaccine, particularly if they weren't vaccinated as children, or if they don't have immunity. This is important for women of childbearing age. Those planning to become pregnant should confirm their rubella immunity. If they're not immune, they can receive the vaccine, but not during pregnancy. It should be given at least a month before pregnancy. Healthcare workers. Individuals in healthcare settings who may be exposed to the virus should be vaccinated if they're not already immune. International travelers. Since rubella is more common in some countries, travelers to these areas should ensure their immunity. Booster shots. For most people, 2 doses of the MMR vaccine provide lifelong immunity, so boosters aren't typically necessary. However, in rare cases, if someone is in a high-risk group, like working in a healthcare setting or living in an area with outbreaks, and their immunity levels are in question, they may receive an additional dose as a precaution. Blood tests can determine whether someone has immunity to rubella. Key points. The MMR vaccine is the standard for rubella prevention and is administered mainly during childhood. Adults who were never vaccinated or aren't immune can receive the vaccine, especially if they are in a high-risk group, like women planning to get pregnant or healthcare workers. For the majority of people, no booster shots are needed after the standard 2 doses, as immunity generally lasts a lifetime. Vaccination programs have dramatically reduced the incidence of rubella worldwide, and vaccination remains the best method to prevent both rubella and its severe complications, like congenital rubella syndrome in pregnant women.
How can society, especially young people, parents, and guardians, be educated on necessary steps to protect themselves and their children from the virus? And what are the social and political strategies that can be employed to raise awareness and take preventive actions? How can the government and the civil society work together in this effort?
Educating society, particularly young people, parents, and guardians, on protecting themselves and their children from rubella requires a combination of public health education, community engagement, and policy measures. Here's how society can be educated and the strategies that can be employed for raising awareness and promoting preventive actions. Education and public awareness. 1. School programs. Schools play a critical role in educating children and young people about the importance of vaccinations. By integrating vaccine education into health classes, children can learn about diseases like rubella and how vaccines protect them. Schools can also ensure that students are up to date on their vaccination. Let me pick up from where you left off. To effectively protect society, especially young people, parents, and guardians from rubella, education and awareness are key. Here's how society can be informed, followed by strategies for collaboration between the government, civil society, and individuals. Education for protection. 1. Vaccination awareness. The most critical message is that the MMR vaccine prevents rubella. Parents need to be informed about the vaccination schedule, its safety, and its importance. Schools, hospitals, and community centers can distribute materials or hold sessions about the MMR vaccine. 2. Public health campaigns. Governments and healthcare agencies can use media, TV, radio, social media, to launch campaigns explaining how rubella spreads and why vaccination is essential. Engaging social media influencers and public figures can be particularly effective in reaching young people. 3. Prenatal care education. Pregnant women and those planning to become pregnant should be educated about the dangers of rubella and the importance of immunity checks. Healthcare providers should discuss rubella during prenatal visits, and vaccination programs should target women of childbearing age who are not immune. 4. School programs. Schools can play a big role in teaching children about the importance of vaccines and personal hygiene. By engaging students through educational materials or events, schools can instill long-term habits and understanding. Social and political strategies. 1. Mandatory vaccination policies. Governments can implement or reinforce mandatory vaccination programs for school entry to ensure that children are protected from rubella. These policies can be supported by campaigns that explain the public health benefits and dispel myths about vaccines. 2. Subsidized vaccines and access. Providing free or low-cost vaccines ensures that socioeconomic barriers don't prevent people from getting immunized. Clinics, schools, and mobile health units can be used to reach underserved populations. 3. Partnerships between government and civil society. Government health departments can partner with non-governmental organizations, NGOs, community leaders, and religious groups to spread awareness and encourage vaccination. These collaborations can help overcome cultural or community-specific barriers to vaccination. 4. Combating misinformation. In the digital age, vaccine misinformation can spread quickly. Governments and civil society can work together to counteract this by promoting scientifically backed information about the MMR vaccine and providing platforms for healthcare professionals to answer questions and address concerns. 5. Engagement with youth. Youth organizations and social media campaigns specifically targeting young people can be used to educate them about vaccines and how to protect themselves. Empowering young people with information will help them become advocates within their families and communities. How governments and civil society can work together. 1. public health task forces. Governments can form public health task forces that include members from civil society, healthcare professionals, and community representatives. 2. Community health workers. Training community health workers to provide local education and help dispel fears about vaccines can have a huge impact. These workers can go door to door, especially in areas where misinformation or vaccine hesitancy is high, offering accurate information and facilitating access to vaccines. 3. Media campaigns. Collaboration between public health officials and media outlets can ensure that public service announcements about rubella and the importance of vaccination are aired on TV, radio, and social media. 4. Monitoring and reporting. Civil society groups can help monitor vaccination coverage and identify areas where vaccine uptake is low. Governments can use this information to target interventions in communities that need them most. By working together, governments and civil society can raise awareness, reduce the incidence of rubella, and prevent outbreaks, ensuring better health outcomes for everyone, especially children and pregnant women.
Can you provide an academic explanation of how the rubella virus attacks the body when someone is infected? How does the virus invade the cells, and how does our immune system respond biologically?
Certainly. When a person is infected with the rubella virus, the infection process involves several key steps, including viral invasion, replication, and the immune response. Here's a detailed academic explanation. Viral invasion. 1. Entry. The rubella virus primarily enters the body through the respiratory tract when an infected person coughs or sneezes, releasing virus-laden droplets into the air. The virus can also spread through direct contact with contaminated surfaces or objects. 2. Initial infection. Once inside the respiratory tract, the virus attaches to host cells, specifically epithelial cells lining the respiratory tract. The virus uses its surface proteins, particularly the E1 and E2 glycoproteins, to bind to specific receptors on these cells, facilitating entry. Cellular entry. The rubella virus enters host cells via endocytosis, a process where the cell membrane engulfs the virus, creating a vesicle. The acidic environment within the endosome triggers changes in the viral envelope, allowing the viral membrane to fuse with the host cell membrane, releasing the viral RNA into the cytoplasm. For replication inside the cytoplasm, the viral RNA is translated into proteins and the viral genome is replicated. The newly formed viral proteins and RNA are assembled into new virions, virus particles, and then transported to the cell membrane. 5. Release. The newly assembled virions bud off from the host cell, acquiring a portion of the cell membrane in the process. This allows the virus to infect neighboring cells, leading to widespread infection. Immune response 1. Innate immune response. Recognition. The body's innate immune system recognizes the presence of the rubella virus through pattern recognition receptors, PRRs, such as toll-like receptors, TLRs, which detect viral components. This recognition triggers the activation of immune cells like macrophages and dendritic cells. Cytokine production cells release cytokines and chemokines, signaling molecules that promote inflammation and recruit other immune cells to the site of infection. 2. Adaptive immune response. Activation of T cells. Dendritic cells process viral antigens and present them on their surface via major histocompatibility complex MHC molecules. This activates CD4 plus T helper cells and CD8 plus cytotoxic T cells. CD4 plus T cells help coordinate the immune response, while CD8 plus T cells can directly kill infected cells. B cell activation. B cells also recognize viral antigens and, with help from T cells, differentiate into plasma cells that produce neutralizing antibodies. These antibodies bind to the virus, preventing it from infecting new cells and marking it for destruction by other immune cells. Memory formation. After the infection is cleared, some T and B cells differentiate into memory cells, which persist in the body. These cells enable a faster and stronger response if the body is exposed to the rubella virus again in the future. Clinical implications. The immune response is typically effective in clearing the rubella virus from the body, leading to recovery within a few weeks. However, the initial infection can still cause mild to moderate symptoms such as fever, rash, and lymphadenopathy. In some cases, especially if a pregnant woman is infected, The virus can cross the placenta and cause serious complications in the fetus. The innate immune response serves as the first line of defense, while the adaptive immune response provides targeted protection and memory against future infections.
Are there cases where a person can get infected with the virus again after recovering from a previous infection and experiencing the same symptoms? If this is possible, could it be due to a weak immune memory?
Reinfection with the rubella virus is rare but possible. Here's an overview of how this can occur. Reinfection possibility. 1. Immune memory. After recovering from rubella, most people develop strong immune memory due to the adaptive immune response. This typically involves the formation of memory T cells and B cells, which enable the body to respond quickly and effectively to future infections with the same virus. 2. Immune evasion. Although rare, reinfection can occur if there is weak immune memory or if the virus undergoes mutations that allow it to evade the immune response. In general, rubella does not mutate as rapidly as other viruses, like influenza, but changes in viral strains could theoretically lead to reinfection. 3. Immunocompromised individuals. People with weakened immune systems, such as those undergoing immunosuppressive therapy or living with certain conditions, like HIV/AIDS, may have a reduced ability to mount an effective immune response. This can increase the risk of reinfection, although it remains uncommon. Symptoms and clinical presentation. If reinfection occurs, it might present with similar symptoms to the initial infection, such as fever, rash, and lymphadenopathy. However, the overall severity of symptoms in cases of reinfection is often milder due to the existing immune response. Vaccine considerations. The rubella vaccine is highly effective and provides long-lasting immunity in most individuals. Vaccination is a primary strategy for preventing rubella infection, especially in populations that may not have experienced the disease naturally. In summary, while reinfection with the rubella virus is possible, it is quite rare due to the strong immune memory that typically develops after the initial infection. In cases of weak immune response, or in immunocompromised individuals, there might be a higher risk of reinfection.
Some people believe that if they had the virus in childhood and recovered without being vaccinated, it means their immune system has naturally produced antibodies and retained the memory of the virus. As a result, they may think vaccination is unnecessary. What is your opinion on this type of thinking?
The belief that recovering from rubella in childhood provides sufficient immunity, making vaccination unnecessary, is a common perspective, but it has several important considerations. Natural immunity versus vaccination. 1. Natural immunity. It's true that recovering from a rubella infection generally leads to the development of antibodies and immune memory. Most individuals who recover will have long-lasting immunity to the virus, which can protect against reinfection. 2. Vaccine benefits. However, relying solely on natural infection can be risky. Rubella can cause serious complications, especially in vulnerable populations such as pregnant women. Vaccination not only protects the individual, but also helps prevent outbreaks and protects those who cannot be vaccinated, such as infants and individuals with compromised immune systems. 3. Community immunity. Vaccination plays a critical role in achieving herd immunity. When a significant portion of the population is vaccinated, it helps limit the spread of the virus. This protects those who may not have adequate immunity, including those who are too young to be vaccinated or those with certain medical conditions. 4. Risk of complications. While childhood rubella infections are often mild, complications can occur, including encephalitis and thrombocytopenic purpura. Vaccination eliminates the risk of these complications while still providing immunity. 5. Booster considerations. In some cases, vaccine-induced immunity can be more reliable and can also prompt a stronger immune response. Vaccines can provide a controlled and safe way to develop immunity without the risks associated with natural infections. Conclusion. In summary, while natural immunity from a past rubella infection does provide some protection, vaccination is a safer and more effective approach to ensuring long-term immunity. Vaccination not only benefits the individual, but also contributes to public health by preventing outbreaks and protecting vulnerable populations. Therefore, it is generally recommended that individuals who have not been vaccinated consider getting the rubella vaccine, even if they have had the infection in childhood.
Can you conclude this discussion with a brief summary that includes a message directed at young people, adults, parents, and guardians about the importance of protecting themselves and their children from the virus?
In summary, rubella is a contagious viral infection that can lead to serious complications, particularly for pregnant women and their unborn children. While natural immunity from past infections may provide some protection, vaccination remains the most effective way to ensure long-lasting immunity and prevent outbreaks. To young people, adults, parents, and guardians, it's crucial to protect yourselves and your children from rubella by getting vaccinated. Vaccination not only safeguards your health, but also contributes to community immunity, helping to protect those who are vulnerable. Stay informed and proactive about your health. Vaccination is a simple yet powerful step in ensuring a healthier future for everyone.
Thank OpenAI for putting you at our disposal.
You're welcome. I'm glad to be here to help you with your questions and discussions.